Now we've previously talked about using an ottoform splint to separate the first and second toes after bunion surgery, but occasionally if the ottoform doesn't fit or it's uncomfortable or it's not appropriate depending on what procedures have been performed, we can also splint the big toe in a straighter position with some form of taping as well. So here we're using Fix-A-Mole, but you can use sports tape, micropore, or whatever taping that your practitioner has advised you to use. Now, in previous videos we have talked about different ways of cutting the Fix-A-Mole. So if you cut the Fix-A-Mole along its width, unfortunately the taping stretches so it doesn't form a stable structure as a post-operative splint. So you want to cut the Fix-A-Mole along its length instead, and if you cut it along its length, it does not stretch and it forms as the perfect splint after any foot or toe surgery. So as you can see, the Fix-A-Mole does not stretch. So now that you've got a nice length of Fix-A-Mole, probably that extends from the big toe to the arch, what you do is you take off the adhesive backing, and now you start with one end of the Fix-A-Mole on the inside of the patient's big toe. You bring the toe into a nice straight position, and then you anchor the piece of Fix-A-Mole over across onto the arch of the foot. Just like that. And you might want to repeat that 2 or 3 times to maintain the straight positioning, and it's possible that we might continue the splinting for up to 2 to 3 months after a bunionectomy as well.